Hello students, today we are talking about a second section of a topic which is pertaining health risk because of doping. Previous sections we talked about what is doping and the history behind doping. Today we will be talking about moreover what is doping, the list in the prohibited list, and what are the consequences or the health risk which is associated by the use of doping substances. So we will be talking about the following points under this section. So we will be starting with the section 2, and the section 2 topic today is health risk and consequences of doping. The following points will be covered today, that includes components of sport performances, the classification of the drugs, classification of prohibited list of drugs, the pharmacological action of the drugs, and health risk, short-term risk and the long-term health risk. So we will be starting with our first slide, that is the component of the sport performance. Now this sport performance includes the 4 topic, that is the sports need skill. Now the skill includes speed, reflex, concentration, limb-eye coordination that is seen in a sports event like in shooting or archery. Then second level is strength. This strength requires muscle mass like for example weightlifting or boxing. Third component is stamina. The stamina needs hemoglobin level high and maximum oxygen transfer that is frequently seen in marathons, race. And the last is aerobic conditioning, and aerobic conditioning require cardiovascular conditioning, means a good heart pumping and the cardio which is seen in the games which use lot of endurance and requires lot of staminas like in cycling. Now the WADA guidelines have been laid that shows a prohibited list. So in the earlier section we talk about why the WADA has laid the extensive prohibited list that was being added every year, and that is divided into different drugs. So the WADA has established different drugs list, and that drug list according to sports pharmacology is not depending upon the chemical structure or its mechanism. It is depending upon the use in sports. Now this drug is broadly classified into 3 types. First is ergogenic drugs, as ergogenic is a performance enhancing drug and this is used to increase the performance, and it has commonly AAS, that means anabolic androgen steroids. Another is recreation drugs, as its name suggests, it is used for recreation to relieve the stress, to be used as social drugs or as a stimulant, particularly marijuana. And third is therapeutic indications drug, that means therapeutic drugs, and it is used for treating any particular disease or ailments, like example type 1 diabetic athlete using insulin. Now these athletes were using a same drug for different purposes, like for example we have seen that amphetamines which was being used by athletes, these amphetamines are used for different purposes, like they are used by athletes first as an endurance sports such as cycling or an ergogenic aid to increase the alertness and daily fatigue. Secondly, amphetamines in the form of methamphetamine, which is also called as meth, crystal meth or ice, they are used recreationally by athletes as a euphoriant and can lead to increase the use and addiction. And thirdly, the amphetamines can also be used as a therapeutic purpose for attention deficit hyperactive disorder. They are therapeutically used to treat attention deficit hyperactive disorder ADHD with drugs such as amphetamines combinations or methylphenidate to help with concentration during schools. So a same drug amphetamine can be used in all the 3 ways. So it is not necessarily what is the chemical formula, it depends upon the use. Now the WADA has laid a prohibition list that can be used in different games. It's not necessarily a single drug to be used in every game depending upon the functions of that particular drug. So, the first type is substances and methods that are prohibited by WADA in all the times, means on all the events. It includes S0, a specified substance, with an example of troponin activators. S1, under S1 comes anabolic agents, clenbuterol, S2 peptide hormones, growth factors, particularly erythropoietin or cobalt. S3 includes beta 2 agonist, that is salbutamol, reproterol. S4 includes hormonal and metabolic modulators like aromatase inhibitors or anti-estrogenic substances. S5 includes diuretics and masking agents like furosemide, dextran. M1 has manipulation of blood and blood components, which includes perfluorochemicals like we have studied oxygen carriers. M2 has chemical and physical manipulation like sample substitution or bean adulteration, and M3 includes gene and cell doping that has genetically modified cells. Now, another set of substances are prohibited in competition. In competition means that in a particular event. It includes S6 that has stimulants, particularly cocaine and another types of methyl deoxymethyl amphetamine, or S7 narcotics, particularly heroin. S8 is cannabinoids, tetrahydrocannabinol, and S9 includes glucocorticoids, that is cortisone. The third level of prohibited list includes the substances that are prohibited in a particular sports, and this has P1, beta blockers, used with an example of atenolol, alpranolol. Now, these drugs have effects and a definition with their functions and side effects. The anabolic steroids, which we commonly know as the steroids, which have been used as a PEDs, that means performance enhancing drugs, they had the use to be as a definition. This anabolic steroids have a definition of the synthetic hormones that actually help in building the muscles and also help in quick recovery of the athletes as it promotes the muscle growth. Now, how it functions? It functions by mimicking testosterone. It aids in muscle repair and speeding up the muscle building. So, an athlete can train harder and increase its performance. Now, it also have a side effects. Now, the side effects has a kidney failure, mood swings, then there is impotence, infertility, high blood pressure, high heart attack risk. Then second type is peptides. Now, the peptides have included within the hormones which are synthetic hormones and that copy the natural hormones which are present in the body. These are namely two hormones. First is human growth hormone. The human growth hormone has action of an anabolic steroid and it develops muscles and also increases the fat burning and reduces the tiredness. The side effects are human growth hormone, particularly of the human growth hormone side effects. It is cardiomegaly, it is carpal tunnel syndrome, lipid profile abnormalities. Then another set of peptide hormone is erythropoietin. It is helping to produce red blood cells and thus increasing the oxygen carrying capacity of the blood. So, more oxygen is provided to the muscles, it allows the athlete to work harder and for longer purpose without getting tired. It has its own side effects of increasing the cardiovascular effects, hypertension, acute myocardial infarction, arrhythmias and thrombosis. Next list of prohibited lists includes analgesics. So, it has been frequently used as a painkillers and as an addictive drugs, can be given orally or injectables. Now, what is its function? It reduces the sensation of the central nervous system and it helps with the pain, it eases pain with having its own side effects with a loss of concentration, dizziness, loss of balance, vomiting and nausea. Then comes stimulants. The stimulants also has an action on the central nervous system and the peripheral nervous system, and its use is a psychostimulant because it increases the alertness and hyperactivity with alteration of the mood. Now, function is it used to reduce the feeling of tiredness, and athletes can train for longer period without feeling tired. And it also stimulates central nervous system, it alerts the mood, it improves the reaction time of the athletes and increase the arousal, triggers relaxation and confidence. It has a side effects causing irritability, insomnia, anxiety, tremors, tachycardia and gastric irritation. Then comes the diuretics. Now, in diuretics, the drugs which increase the rate of water loss from the body. Now, its function is it speeds up kidney functions by producing more urine outputs. So, by increasing the more urine outputs, it helps the athletes to lose weight loss. It helps the athletes for rapid weight loss and often used in sports where the weight categories are important. The athletes may use the particular diuretic to participate in a particular event where a certain weight is required. It has its own side effects of causing dehydration, dizziness, muscle cramps, nausea and fatigue. In diuretic, there is also a use of masking agents. So, the masking agents, they hide the effect of other performance enhancing drugs. So, it increases the urine output and also mask the agents which have been used as a PEDs. Then comes the beta blockers. Beta blockers is usually used for a relaxing purpose or for weakening the stress effect. Now, its function is to maintain a slow heart rate, to maintain blood pressure and to keep a hold over an intense or tensive condition, tense situation. It has its calming effect. The side effects is having a low blood pressure and heart condition and may cause depression. Now, M1 categories has a manipulation techniques, the manipulation of blood and blood components. The following are prohibited under first category